Welcome back to the C Morning Show, everyone. We're now into the final hour of our program, which leads us to our second discussion of the morning. Now, having good sexual and reproductive health means feeling physically, mentally, and socially well in everything related to the reproductive system. And it's also important for an individual to be informed and feel empowered to protect themselves from STDs or sexually transmitted diseases.
That is right, Paul. And the reality in developing countries is that 20,000 girls give birth under the age of 18. And when a girl becomes pregnant, her life changes instantly and dramatically. She will most likely drop out of school and find it hard to land a job. Now, this can also affect her mental health and make her even more vulnerable.
That is an alarming number indeed, and therefore it is crucial for both women and girls to have easy access to sexual and reproductive health information as well as its accompanying services. And to find out more about this topic, we're now going to have a deep dive with Sandeep Nanwani, who is a sexual and reproductive health program specialist from the United Nations Population Fund, which is the UN Sexual and Reproductive Health Agency. Good morning. Thank you for joining us today.
Thank you very much for having me today morning.
Right.
Absolutely.
Let's get started by you explaining a little bit more about the organization, the United Nations Population Fund, or UNFPA, and what it does.
Yeah, so the UNFPA, or the United Nations Population Fund, is the United Nations Agency for Sexual and Reproductive Health. Now you may ask, why do we need a UN agency for sexual and reproductive health? But as you may know, and as many of your audience may know, sexuality is an integral part of human welfare. It's a part of our lives since our birth, right? So when mothers give birth to newborns, that's part of reproduction, that's part of sexuality. And a lot of mothers die from really preventable causes, and that's a serious public health and development issue, and that's why we tackle that issue. For instance, when a young girl gets circumcised, that's a harmful practice that will affect her reproductive life in the future. And so we work to abandon that harmful practice. When a young girl gets pregnant because she's forced to marry, or because she gets pregnant from different accidents, it means her whole life and opportunities has been destroyed. And that requires specific attention and work to address those issues. And then when a woman is in her marriage life or is in a reproductive life, she has to have the power to decide when to get pregnant, how many children she wants to have, if she wants to have children, and when to have them, and with whom to have them, with the right person planned. And that requires the magic of contraception. When women get contraception, they can plan pregnancies, and when they can plan pregnancies, they can work, they can pursue career, they can pursue opportunities, education, whatnot. Because it's so important and it's so integral to our livelihoods, that's why the UN member states, they've made a specific agency to tackle sexual and reproductive health. Because it's so foundational, from birth to infants, to adolescents, to women. It's so integral to the lives of especially women and girls, but including men too, that the UN made a specific agency for sexual and reproductive health. And that's why we exist here.
Yeah, no, I think it makes perfect sense, especially, and I would argue it is more important to have that for developing countries as well. I like to draw on a personal experience that I had as well, where my wife and we went to have a natural birth in the island of Bali, and we did it at a place where everything was, it wasn't a hospital, it was actually more of a natural health care place where they birthed our first child. It was a gentle birth, it was a water birth, and I found out during that time that they said, we can prioritize you only if there's no other ones in need. And I said, like, who would be like prioritized ahead of us? They said, well, somebody who doesn't have the means to give birth that otherwise might give up their birth or have it in a non-sanitary way or in a place that's dangerous for their fetus. I'm like, how often does this happen? They said, a lot more than you think. So again, that's why I argue that this is a very important point for us to have here in a country like, especially developing countries as well. Now, what sort of access does your organization provide?
So our organization, we've helped member states, and including Indonesia, to address three things. The first is to end preventable maternal deaths. The second thing is to end any unmet need for contraception and family planning, so that women can decide when, if she wants to get pregnant.
Right.
Yeah.
And the third thing is to end any harmful practices like child marriage, right? So those are three objectives. What we do is we support member states and we support governments, like in Indonesia, to implement policies and programs to address these issues. How do we do this? We do this through policy advice, through brokering expertise, through evidence research generation. We also provide experts from best practices from other countries,
Right.
how they have tackled these
Right.
issues, because these issues are can be tackled. Countries have been successful in tackling these issues, and we are here to help countries learn from each other.
Yeah.
And Indonesia has issues in these three issues. It has a high maternal mortality,
Absolutely.
high unintended pregnancy rates, but it has also done a lot of progress as well.
Right.
Yeah.
Yeah, and we're aware that you have been working with the Indonesian government for 50 years now.
Yeah.
You mentioned earlier, that is a long time. How has the programs evolved from when you first started to where it is now?
Yeah, so initially we were supporting at the start 50 years ago in the family planning program. As you know, family planning, people who grew up in the 70s or 80s in Indonesia might know the only 2 children policies
Right,
and
yes.
so on. But you know what? In '94, there was a global conference and commitment in Cairo called the ICPD, where it changed the understanding of population and family planning, where instead of thinking of family planning as reducing population growth,
Yep.
we started thinking about sexual and reproductive health as a right for the woman to decide herself if, when, and how many children she wants to have. And that was the trigger point that changed our organization, UNFPA, and our support to the government of Indonesia. Since '94, we've been supporting on those 3 issues. We've been working to end preventable maternal deaths. You may know, for instance, in Indonesia, the maternal mortality ratio is 189 per 100,000 live births.
Okay.
That means one mother dies every hour. If you look at if you estimate 4.6 million live births a year, so one mother dies an hour. Given our economic situation, it is completely unacceptable and an anomaly.
Yeah.
It's a total anomaly, because there are countries like Sri Lanka, much more poorer than us, that has really reduced maternal mortality. So we have a really high
not
maternal
I've heard of this
mortality.
number
Yeah.
too.
Yeah, it's
absolutely
absolutely
Wow.
staggering. Every year we have around 9 million unintended pregnancies.
Okay.
For women, mostly, they have unintended pregnancies. So they don't have access to contraception, or they don't have access
Yeah.
to information on what kind of contraception works best for them. And unintended pregnancies can mean you drop out of your career, you lose education opportunities,
Yeah.
and so many other things.
Okay.
And then we have child marriage as well, and adolescent pregnancy. So our program has evolved since the ICPD Cairo conference to work on sexual and reproductive health as really a development and human rights issue,
Right.
instead of a population boom or
Right.
kind of issue that was traditionally our work before the ICPD
Yeah,
here.
and I think it's a more personal approach to
Yeah.
things. And speaking of which, when it comes to Indonesia, I assume there's plenty of challenges that you face, especially
Yeah.
when you try to implement these programs.
Yeah.
One of them could be pushback from more, traditional mindsets as well.
Yeah.
One of it could be just the lack of awareness when
Yeah.
it comes to these issues. And
Yeah.
finally, the fact that some of these issues are still deemed taboo to some conservative kind of groups as
Yep.
well. So how do you tackle some of these challenges that you see?
So one of the biggest challenges that we face is just the huge vastness of Indonesia and the huge diversity
Yeah.
with over 250 million people, right? So it's really hard to ensure these essential services, to deliver these essential services to women and girls across the nation,
Right.
because there are areas where you can't deliver blood banks to save a
Right.
mother, for
Yes.
instance, or you can't you don't have ventilators to save the newborn, or things like that. So the vastness of Indonesia makes it a specific challenge on its own. But one way we have worked to tackle some of the issue, including pushback, is to work with midwives. Midwives are our core partners because midwives are the most closest partners to women and girls in the communities.
That's very true.
Midwives are like their partners to women and girls. Every problem that a woman and a girl faces, they go to midwives.
Yes.
And for us at UNFPA, we think that investing in midwives' education and ensuring they are competent to the most highest attainable standard, to international standards, will really solve a lot of these issues because midwives are also leaders in the community.
Bidas, we call them.
Bidas, right.
Yes, in Indonesian. That's right.
They can change norms. They can change all of these harmful practices. They are like leaders and they are partners. They're the main partners for women and girls in the community. So UNFPA, we believe that one of the most fundamental way we tackle these challenges, specifically in Indonesia, is through working with midwives. Indonesia has 400,000 midwives, all powerful women leaders out there in communities delivering life-saving services.
Yes.
And if we can educate, we can support them to deliver highest quality services, we can save a lot of women and girls. So we really believe in our midwives here.
Great approach.
Yeah.
Never thought of
I've
it.
never, you'd never really think much about midwives.
Oh, I mean, a midwife delivered our first baby, so that's,
There you
that's
go.
what I was explaining. Like, we had 100% instilled our trust in her, using a lot of her instincts as opposed to medical and technical procedures as well.
Absolutely.
It's amazing what they know and what
Especially being like a woman in this day and age, when you think about, having kids and starting family, you don't really think about midwives because that's...
we did.
Yeah,
I'm glad we did because
that's
I learned
something
a lot.
to think
I learned a lot
about for
that.
sure.
Yeah.
Sandeep, so what are some of these programs, just really out of curiosity, how does that look into practice? Like if some of us really want to get involved, we want to learn more about this, how do we do that?
So we do a lot of interventions. That includes, for instance, through we work with a community of practice of influencers, for instance, that talk about sexual and reproductive health, the importance of protection for gender-based violence to young people. We have a community of practice. So if anyone wants to join this community practice of social media content creators, please do contact us. We can certainly include you. We work with governments. We develop models. We work with schools, for instance, to teach about sexual and reproductive health. We work with midwifery education schools so that they can teach and midwives to be competent. We work with midwives association so that they can be supported to deliver quality care, respectful care, as you said, because a midwife will make sure when a woman delivers that she has a companion, that every little pain, every little issue she has during childbirth or during her whole reproductive life is taken care of. That's the power of a midwife, right? So we work with midwives, we work with young people, and we also work with human rights institutions like Komnas Perempuan. So we work with Komnas Perempuan to really look at the evidence on what are the human rights issues surrounding sexual and reproductive health. So outside working with governments, we do work with the young people, with the midwives, and with the human rights institutions in Indonesia.
All right. So you mentioned a lot about the access and the programs and education. What is the impact? I mean, you've been here as well now for a few years. What are the impacts that you've seen, both on the regional level, the local level, as well as the national level, as a country, as a whole?
Yeah. So, in terms of maternal mortality, Indonesia is doing better. 5 years ago, it was 305 per 100,000 live births. So 5 years ago, it was 2 women dying every hour. Now it's 1 woman dying every hour. It is still huge, still a major challenge for Indonesia. We have pockets like Papua, which has a maternal mortality as far as Afghanistan. So that's so we have seen some improvements because of all our work and concerted work by the government, but there's a lot more to do. In terms of family planning, Indonesia is actually one of the leading countries in the region. Indonesia has one of the highest contraceptive prevalence rates, so women have most access to contraceptive to a huge range. The government gives a huge range of contraception. The remaining issue is the information education to the women. So the government provides, BKKBN here provides a range of cafeteria of options, free of charge, but the problem is women needs to be informed.
They're not aware of this.
They're not aware. So that's the remaining challenge so we've seen improvements there. We've seen improvements in child marriage. We see the numbers going down, but that's because more women continue school, more women are educated. That's a really promising trend. Although we see a lot of dispensation because of pregnancy. So because adolescents get pregnant, so they're forced to get married.
Right.
So there remains an issue, and to address that, you need a comprehensive approach. You need good sex education in school. You need parents to talk to adolescents in a kind and respectful way on about relationships, about sex, because parents don't do that now, right?
No, especially not here.
Not here.
Definitely.
It's not the most comfortable conversation. It needs to be had.
But it needs to be had, and actually young people want to listen to their parents. They really want to talk to their parents openly and safely about this. So that remains an issue in that sense. And one other issue is actually female circumcision or female genital mutilation. Female genital mutilation remains high, but what is great is that now we have data. About half of the women here has undergone female genital mutilation or cutting, and we have that data. And now, because we have that data, Indonesia can start to reduce and abandon that really harmful practice.
It's outdated as well.
It's outdated, harmful traditional practice.
Right.
Yeah.
Absolutely. Well, Sandeep, if we want to learn more, where can we find you guys?
Yeah, so you can find us in our social media. We have, you can just follow in Instagram, UNFPA Indonesia. You can also look at our website at unfpaindonesia.org. You can also contact us in our website, and you can just contact us and we'll reply immediately.
Awesome.
By the way,
we're happy to work with anyone that's interested in this topic.
I've got an influencer here who's going to be getting married and family planning soon.
Oh,
so
yes.
she might be
I'll definitely be reaching out. I was actually asking for me.
Perfect.
Thank you very much, Sandeep, for taking your time.
Thank you so much for your time, Sandeep.
Thank you so much for having us.
Absolutely. All right, folks, we'll be taking another break, but right after, we will have our special segment, Salam Ramadan with Ralphie. Stay with us.